ขอเข้าสู่เซสชันเกือบสุดท้ายนะคะแต่ไม่ท้ายสุดแต่เป็นเซสชันที่สำคัญมากเพราะเป็นเซสชันว่าด้วยผู้ให้ทุนนะคะหรือว่าผู้ที่จะให้การสนับสนุนในส่วนของเรื่องของ resource ต่างๆนะคะก็ขออนุญาตนะคะว่าในส่วนเซสชันนี้จะดำเนินรายการเป็นทั้งภาษาไทยแล้วก็ภาษาอังกฤษนะคะก็ขอสวิชเข้าภาษาอังกฤษก่อนแล้วกันนะคะ Welcome to the nearly the last session before the closing ceremony, and this session will be running by the same time as you have the coffee break. I hope you wake up and enjoy this session of resource mobilization. This session aims to introduce the agency roles, contributions in supporting action addressing AMR. It will provide a good opportunity to share and discuss potential cooperation with audience in this room. And this session will start with a 7-minute presentation because we have 9 panelists together. So each speaker is from the agency will share the scope of work and the area of interest to support funding or mobilization resources to support AMR research or actions. After we complete all 9 presentations, we will have an opening session for question and answer and discussion. First of all, I would like to invite the first speaker will be from Thailand. ขอเรียนเชิญดร.นพคุณธรรมรัตน์อารีนะคะเป็นผู้จัดการงานวิจัยจากสถาบันวิจัยระบบสาธารณสุขขอเชิญขึ้นบนเวทีเลยค่ะขอพูดที่โพเดียมได้ค่ะ
วันนี้ก็ขอมาแชร์บ้างนะคะในส่วนของผู้ให้ทุนสนับสนุนงานวิจัยค่ะจากสวทศนะคะก็จะขอพูดถึงงานวิจัยในช่วงที่ผ่านมานะคะโดยสังเขปแล้วก็จะพูดถึงสิ่งที่อยากเห็นในอนาคตค่ะก็เรามีงานวิจัยที่เกี่ยวข้องกับเชื้อดื้อยานะคะอย่างเป็นรูปธรรมเนี่ยนับไปก็ตั้งแต่ประมาณปี 2005 นะคะในรูปแบบของโปรแกรมที่ชื่อว่า APIA ค่ะ APIA เป็นโปรแกรมoperational หรือว่า policy research นะคะที่โฟกัสเรื่องของโรคอุบัติใหม่แล้วก็รวมถึงเชื้อดื้อยาด้วยนะคะเป็นการทำวิจัยร่วมกัน6ประเทศนะคะรวมถึงองค์กรระหว่างประเทศก็มามีส่วนในนี้ด้วยนะคะอย่างเช่นมี WHO FAO OIE แล้วก็ USAID ค่ะเรามีคอนเซปต์ของ One Health ที่อยู่ในช่วงนี้ด้วยนะคะหลังจากนั้นมาก็จะเป็นเรื่องของการสนับสนุนโครงการ Antibiotic Smart Use หรือที่เราเรียกกันย่อๆว่า ASU นะคะ ASU ก็เป็น Action Research ที่สำคัญมากอันหนึ่งนะคะซึ่งทำให้เกิด awareness ของปัญหาเชื้อดื้อยาในวงกว้างในประเทศไทยมากขึ้นแล้วก็นำไปสู่ความร่วมมือในการแก้ปัญหาแล้วก็มีการทำงานอย่างเป็นระบบเครือข่ายค่ะที่สำคัญก็คือทำให้เกิดแชมเปี้ยนที่สำคัญของวงการเชื้อดื้อยากันก็คือพี่นิธิมานะคะซึ่งเป็นแม่งานของงานในวันนี้นะคะในช่วงต่อมานะคะเราก็มีโครงการเป็นชุดโครงการใหญ่มากๆนะคะเป็นการป้องกันแล้วก็ควบคุมปัญหาเชื้อดื้อยาซึ่งปัจจุบันนี้ดำเนินการมาถึง4เฟสแล้วค่ะโครงการนี้เขาก็ไปหาขนาดของปัญหาในทั้งในโคนสัตว์แล้วก็สิ่งแวดล้อมแล้วก็นำเสนอวิธีการในการป้องกันแล้วก็ควบคุมปัญหาเชื้อดื้อยาในภาคส่วนต่างๆที่กล่าวมานะคะต่อมาเราก็มีโครงการ CCSMR ซึ่งได้พูดถึงกันไปพอสมควรแล้วนะคะตั้งแต่เมื่อวาน สำหรับงานวิจัยในอนาคตนะคะก็ก่อนที่จะไปถึงเนี่ยก็อยากจะพูดถึงว่าจากงานวิจัยในช่วงที่ผ่านมาเนี่ยได้เกิดการนำมาใช้ทางด้านนโยบายหรือว่าในทางการปฏิบัติยังไงบ้างนะคะโดยสังเขปค่ะในด้านนโยบายนะคะเรามีการผลักดันให้เกิดแผนยุทธศาสตร์เชื้อดื้อยาแห่งชาติมีการคิดตัวชี้วัดนะคะที่เป็น Service Plan ของกระทรวงสาธารณสุขค่ะในแง่ของการใช้ยาสมเหตุผลรวมถึงเชื้อดื้อยาแล้วก็มีการคิดตัวชี้วัดนะคะ P4P ของสปสช.ซึ่งจะเป็นการจ่ายเงินเพิ่มพิเศษให้กับสถานพยาบาลที่สามารถผ่านเกณฑ์ตัวชี้วัดนี้ได้นะคะซึ่งทั้งสองเรื่องของ Service Plan แล้วก็ P4P เนี่ยได้ผลมากนะคะในการควบคุมปริมาณการใช้ยาโดยเฉพาะในสถานพยาบาลขนาดเล็กในโรคพื้นฐานนะคะก็คือมีหวัดเจ็บคอท้องเสียพวกนี้ค่ะจากที่เมื่อก่อนเราใช้ยาฆ่าเชื้อเป็นรูทีนก็มีการใช้ลดลงนะคะในฝั่งของกรมปศุสัตว์เองค่ะก็ทำงานร่วมกับนักวิจัยของเรานะคะก็มีการแบนตัวโคลิสตินที่ใช้ผสมในอาหารรวมไปถึงยาตัวอื่นๆด้วยนะคะเพื่อให้เกิดการใช้อย่างระมัดระวังมากขึ้นทางอย.ก็มีการ reclassification ยาหลายตัวนะคะเพื่อควบคุมการใช้ยาแล้วก็ทำให้เกิดความปลอดภัยในการใช้ค่ะในทางฝั่งระหว่างประเทศนะคะนักวิจัยของเราก็มีการผลักดันนะคะเพื่อให้เกิดการลงโค้ด ICD เวอร์ชัน11นะคะเพื่อให้มีการลงว่ามีปัญหาเชื้อดื้อยาสำหรับคนไข้นะคะนี่ก็เป็นตัวอย่างในด้านของ policy ค่ะทางปฏิบัติเนี่ยจริงๆมีเยอะมากนะคะลองรวมมาเป็นบุลเลตใหญ่ๆอย่างที่เห็นเมื่อวานเนี่ยก็จะมีการนำเสนอผลของการ surveillance ค่ะหลายๆโครงการมีการพัฒนาชุดทดสอบที่ใช้ทดสอบเชื้อดื้อยามีการจัดทำรายงานฟีดแบ็กเพื่อให้หน่วยงานที่เกี่ยวข้องนะคะได้รับทราบว่าความรุนแรงของปัญหาไปถึงไหนแล้วนะคะอย่างที่เมื่อวานนะคะมีหลายโครงการอยู่มีการทำ anti microbial stewardship มีการ awareness ที่เกิดขึ้นในวงกว้างในสังคมนะคะมีการถามค่อยคนไข้ถามหมอว่าตกลงที่เขามาเนี่ยเขาเป็นไวรัสหรือแบคทีเรียหรือว่ามีการรณรงค์ว่ายาฆ่าเชื้อไม่ใช่ยาแก้อักเสบค่ะประมาณนี้นะคะซึ่งความสำเร็จในที่ผ่านมาในที่กล่าวถึงเนี่ยจริงๆแล้วไม่ใช่มาจากงานของสปส.เพียงคนเดียวนะคะก็ยังมีงานวิจัยอื่นแล้วก็แหล่งทุนอื่นๆด้วยซึ่งที่สำคัญเนี่ยก็คือมันมาจากความร่วมมือในการทำงานแบบเครือข่ายค่ะของภาคส่วนที่เกี่ยวข้องค่ะทีนี้ก็กลับมาถึงว่าในอนาคตอยากจะเห็นงานวิจัยแบบไหนนะคะก็คือสิ่งที่ได้พูดในสไลด์ตะกี้ค่ะว่าเราต้องการให้งานวิจัยที่ทำเนี่ยสามารถเปลี่ยนความรู้ให้เป็น policy intervention ได้นะคะว่าจะนำไปใช้ในการแก้ปัญหาในภาคส่วนของประชาชนผู้ให้บริการแล้วก็ภาคของนโยบายได้ยังไงค่ะค่ะก็ขอจบที่สไลด์นี้นะคะเป็นงานวิจัยเล็กๆในปีตั้งแต่ปี 2012 ค่ะที่นักวิจัยเนี่ยเขาประมาณความเสียหายที่คาดว่าเกิดจากเรื่องเชื้อดื้อยานะคะทีนี้พวกเราที่ทำงานตรงนี้ทุกคนนะคะก็เราเชื่อว่าเราเนี่ยอยากเห็นความเสียหายตรงนี้ให้เปลี่ยนจากความเสียหายมาเป็นเกณฑ์ได้ไหมอย่างเช่นเราจะทำยังไงเพื่อให้ช่วยชีวิตกว่า 40,000 ชีวิตเนี่ยต่อปีแล้วก็ได้เกิดการประหยัดค่าใช้จ่ายด้านยากว่า 6,000 ล้านบาทจะได้เอาไปใช้รักษาโรคราคาแพงหรือว่าโรคหายากอื่นๆนะคะแล้วก็ได้เพิ่มคุณค่าทางเศรษฐกิจให้กับประเทศนะคะ 40,000 ล้านบาทต่อปีอันนี้ค่ะก็สุดท้ายนะคะก็ขอขอบคุณผู้จัดงานนะคะแล้วก็ขอบคุณนักวิจัยทุกท่านนะคะที่2 วันนี้ทำให้เราทุกคนได้เห็นว่าlandscape ของเรื่องเชื้อดื้อยาเนี่ยมันมีอะไรบ้างนะคะทีนี้ต่อไปเนี่ย สิ่งที่อยากเห็นก็คือการที่เราได้ลองหยิบยกข้อค้นพบจากงานวิจัยอะค่ะลองมาดูซิว่าสิ่งต่างๆเหล่านี้จะสามารถนำมาเปลี่ยนแปลงปรับเป็นนโยบายหรือว่าข้อเสนอยังไงบ้างที่จะแก้ปัญหาเชื้อดื้อยาค่ะขอบคุณค่ะ
ค่ะขอบพระคุณดร.นพคุณมากนะคะจะมีอีกท่านหนึ่งที่มาจากเป็นส่วนของประเทศไทยเหมือนกันนะคะเป็นคุณชาติวุฒิวังวนนะคะท่านเป็นผู้อำนวยการสำนักสนับสนุนการควบคุมปัจจัยเสี่ยงทางสุขภาพนะคะสำนักงานกองทุนสนับสนุนการส่งเสริมสุขภาพจากสสส.นี่เองค่ะขอเรียนเชิญบนเวทีเลยไหมคะขอเรียนเชิญค่ะ
ครับผมสวัสดีทุกท่านนะครับวันนี้ขอเป็นภาษาไทยแล้วกันนะครับสสส.ทุกท่านน่าจะคุ้นเคยนะครับสสส.เป็นองค์กรในกำกับนะครับอยู่ภายใต้การกำกับของนายกรัฐมนตรีนะครับสสส.ได้งบประมาณมาจากไหน 2% มาจากภาษีสรรพสามิตนะครับจากสุราแล้วก็บุหรี่นะครับก็ปีนี้นะครับเราได้งบประมาณทั้งสิ้นประมาณ 4,000 ล้านบาทเป็นตัวเลขที่ลดลงน่าจะเป็นข่าวดีนะครับเพราะว่าอัตราการเก็บภาษีลดลงแปลว่าคนไทยสูบบุหรี่คนไทยดื่มเหล้าน้อยลงน่าจะเป็นนิมิตหมายที่ดีนะครับถามว่าสสส.ทำอะไรยังไงบ้างบทบาทของสสส.ในงานสื่อสารสาธารณะเนี่ยเมื่อกี้ได้เห็นชัดเจนแล้วว่าเราทำงานในภาคการมีส่วนร่วมของชุมชนนะครับการติดอาวุธให้คนไทยเนี่ยเข้าใจและเห็นภาพของการลดการบริโภคยาให้ได้มากที่สุดนะครับหลายประเด็นเนี่ยหลายครั้งเนี่ยเราพบว่าการใช้ยาอย่างไม่จำเป็นและไม่เหมาะสมเนี่ยเป็นภัยที่ส่งผลต่อสุขภาพของคนไทยนะครับงานที่สสส.ทำอยู่ตอนนี้เนี่ยเรามีคณะกรรมการหลายชุดที่เป็นส่วนหนึ่งของงานสสส.แล้วเราก็ขับเคลื่อนผ่านคณะกรรมการระดับประเทศนะครับรวมถึงหลักๆที่เราทำอีก2 งานก็คือเราทำงานร่วมกับกพย.นะครับเราทำงานร่วมกับมูลที่เพื่อผู้บริโภคแปลว่า2 องค์กรนี้ครับเป็นผู้รับทุนนะครับเพื่อที่จะขับเคลื่อนนโยบายไม่ว่าจะเป็นพลเมืองตื่นรู้คือทำยังไงให้เขามีอาวุธในการติดตามตรวจสอบแล้วก็ใช้ชีวิตอย่างปลอดภัยในการจัดการชีวิตอย่างเหมาะสมนะครับรวมถึงเรามีแอนติไบโอติกวีคซึ่งตั้งใจว่าจะทำกันทุกปีเพื่อให้แน่ใจว่าเป็นสัปดาห์แห่งการรณรงค์เพื่อความปลอดภัยของคนที่ใช้ยานะครับอย่างเหมาะสมนะครับนอกจากนี้นะครับถามว่าสสส.ทิศทางสสส.ต่อไปเนี่ยเราทำอะไรต่อก็จะเป็นประเด็นที่อยู่ในแผนงานของเราจริงๆเนี่ยสสส.ให้ความสำคัญเรื่องการดื้อยาต้านจุลชีพมาหลายปีแล้วครับแล้วก็ยังมีทิศทางที่เราตั้งใจว่าจะให้ความสำคัญอย่างต่อเนื่องนะครับเพื่อให้เรามีสุขภาวะคนไทยในระดับประชากรทุกคนเนี่ยครับมีสุขภาวะที่ดีนะครับโดยหลักๆเนี่ยสสส.คอมมิตในการจัดการในการสนับสนุนในการติดอาวุธทั้งนักวิชาการทั้งภาคประชาสังคมรวมถึงงานสื่อสารสังคมให้คนไทยเข้าใจในประเด็นต่างๆที่นักวิชาการนำเสนอแล้วก็ถอดออกมาเป็นเมสเซจง่ายๆเป็นอินเทอร์เวนชั่นที่จับต้องได้เป็นทิปที่เขาสามารถใช้จัดการความรู้ได้ทุกวันอย่างปลอดภัยนะครับผมขอบคุณมากครับ
สั้นๆกระชับแม้ว่าภาษีจะลดใช่ไหมคะก็ยังเป็นข่าวดีนะคะที่เราอาจจะต้องได้รับการสนับสนุนจากสสส.อยู่ต่อไปนะคะ I would like to switch into English again and the next panelist will be from WHO. Please help me welcome Dr.Richard, the Program Manager Health Emergencies and AMR from WHO.
Good afternoon again. I don't have a presentation. I hope that will be okay. I will try to be clear and brief. So and I will just talk about resource allocation in the context of Thailand. So for WHO Thailand, the funding for antimicrobial resistance comes under something that we call the Country Cooperation Strategy. So every WHO office has a country cooperation strategy, or what we call a CCS. And it's a plan, but it's also a document. And it's really a joint plan between WHO and government, but principally ministries of health or ministries of public health, that identifies priorities for a period of 5 years. In Thailand, the way this CCS operates is completely unique. And it's a model that's been developed progressively over a few years. I think Ajahn Surya has already mentioned something about this. But essentially what we do is we get together with stakeholders and agree a common set of priority actions. But what's unusual is the funding mechanism. So instead of, WHO using some funds to support a specific project, what we do is we club together with concerned agencies who have funds, and we put the money into a common pooled fund. And this is used to provide the resources for these identified priority programs. And we sometimes talk about, or particularly Dr. Suet in your country talks about how this model tries to leverage the social and intellectual capital of WHO together with our convening power to bring together these various stakeholders to agree on these joint priorities. So apart from funds from WHO and funds from the concerned units inside the Ministry of Public Health, I think recently the agencies that have given money are two that you've just been hearing from. So there's the NHSO and Thai Health, but also HSRI, the Health Systems Research Institute. And the amount of money sometimes varies and it comes at different times, but I think the real value of this is that in a way this is kind of extra money. And so what it sometimes does is enables projects to be funded that are not really under the authority or not part of a regular program of a particular agency. So I think one of the things about antimicrobial resistance is it became such an important priority so quickly that countries really needed to start taking action before they really had comprehensive information about the situation. So it was a little bit like we sometimes talk about building the ship while sailing. So I think one thing that this CCS has been able to do is provide funds to almost do a kind of situation analysis. It's to gather together really critical information that's not necessarily the direct responsibility of Thai FDA or the Department of Livestock Development, to gather all this information that really is used to inform policy and the next actions. And one thing about it, although this is really a mechanism that's kind of part of what WHO does, the funds that are used are not used exclusively for projects in human health. I think maybe you heard this already, but a couple of examples are the work that's being done on surveillance of antimicrobial use is looking at both the human and the agricultural sector. There was also a really great piece of work done to try and map out existing research on AMR to identify gaps and identify priorities. And I attended the second half of the workshop and it was really buzzing. You know, all these people had got together from all the different sectors to decide what to do. But this funding mechanism does cause some difficulties, I think, particularly for some donors, because if a donor wants to give money, you will not know exactly how your money is spent. You will not be able to say that activity was funded by this piece of money. It goes into a common pool. I mean, there is a mechanism for audit, so there is some accountability, But I think for some traditional donors, they really need to know exactly how their money is spent. But one reason why I want to highlight this is because if there are agencies present here who are happy with this funding mechanism, who may like to put money into this common pool, then you're very, very welcome to do it. And for example, I've never had a conversation with FAO about this, and it might be difficult to organize, but FAO is actually part of the kind of program steering committee for this program. Maybe that's, or UNEP if you want to do it. So I thought I would finish off by just having a list of what's going to be covered in this year's CCS. So there's a piece of work on an antimicrobial stewardship competency assessment for pre-service physicians, veterinarians, pharmacists. There's work which I hope you've heard about on this integrated AMR management project in hospitals. There's work for a framework of AMR surveillance under the One Health approach. Also development of a joint protocol for surveillance of AMR pathogens and antimicrobial residues in food. It will also be helping with what we call the TISAC, the Thailand Surveillance of Antimicrobial Consumption Year 4. There's a small piece of work on lessons learned from the work that was done to reclassify antibiotics. Also, something on the economic evaluation of infection control in tertiary hospitals. A study on human resources for AMR. Some money will be used for World Antibiotic Awareness Week. And the last thing I've seen on the list is an ASEAN regional consultative meeting on the rational use of antimicrobials. So I think you can see it's a really broad area of work. And some of these, it's difficult to imagine how these would have been funded because it's not really anyone's individual responsibility, particularly to fund work that's very cross-cutting. So, yeah, that's me done. Thank you for your time.
Thank you very much, Dr. Richard Brown, for a very informative. And next speaker will be from the FAO. I would like to invite Dr. Katinka de Balogh, the Senior Animal Health and Production Officer and FAO for AMR. Please, on the stage. Yes, of course.
Thank you. Good afternoon. So I think that's a nice coffee break. Huh? So my quick presentation, I don't know if the slides are here. Yes, thank you very much. Very briefly on the resource mobilization by FAO. I want to present just a few issues. Well, first of all, you already heard this morning about also the FAO action plan that is really encompassing the different sectors. And it's very much aligned with the global action plan. And also here in the region, it's something that we call the regional directions that we are developing, because specifically also here to link in with the other sectors. So with regard to resource mobilization, there are three main funding opportunities that we had. And most graciously, USAID has provided substantial funding to initiate the work on AMR in the region. And also it was interesting to see that it's not only looking at livestock, but also looking at crops and the environment. So here we have addressed several issues. For example, the development of the national action plans was also part of this, as well as improving surveillance and data collection and laboratory capacities. The UK Fleming Fund was instrumental for specific countries in the region. And here we have had projects in Cambodia, Laos, Vietnam, Philippines, and Bangladesh funded from this. And we have tried to often, what we call develop a programmatic approach. So to use the funding most efficiently. For example, is one event is being organized, for example, on the USAID funding to also enable participation from countries that normally would not benefit from that funding for them to participate. Another one is the FAO regular program, and this is what we call the Technical Cooperation Program. And in the past, also Thailand, and Dr. Pom, I see you are here, has benefited from this regular program support. And it's the Ministry of Agriculture that directly requests FAO national office or country office for this support. So it is very much prioritized within the ministry, the requests that go to FAO, and there is clearly a limited fund available. If we look, so this is more on the regional level. We have had one TCP, as we call this Technical Cooperation Program, mostly in the aquaculture sector, addressing the situation in different countries. Then we have also some specific country projects. And here the Fleming Fund, at this moment we have FAO is implementing the country grants for Laos and will start quite soon with Myanmar. And on the Technical Cooperation Program, we have activities in Maldives as well as in Papua New Guinea. This morning, Dr. Balogh also mentioned the tripartite trust fund, and here we have several countries that have been invited. This is a fund that at the moment has funding from the Netherlands and from Sweden, and we hope that also other countries will chip in into this funding. And this is a global fund, so it's overarching not only for Asia Pacific, but also for other regions. So we have several countries have been invited, and within here in the region, it's mainly Cambodia and Indonesia for this first round of funding. So with this, I also would like to mention that FAO headquarters has received funding for from the Russian Federation, but this has mainly been for Central Asia, as well as funding from Norway for also mainly for Africa. So I think this is something very dynamic, and I believe that with the importance of AMR that we will find other funds, other countries to provide funding to this tripartite, partner, not party, no, multi-partner trust fund, exactly. And with this, thank you very much, Kap Kun Ka.
Thank you very much. Thank you very much for your wonderful presentation. And next, I would like to invite the next speaker from the OIE, Dr. Ronello Abila, the OIE sub-regional representative for Southeast Asia on the stage, please.
Thank you. Good afternoon. So for the OIE, I would like first to explain how we are working at the country level. This is the regionally and also at the country level. So the delivery of our activities start with the identification of the gaps. We have this program on the PBS, and then with some support on identifying the gaps also in legislation. And we have this special mission jointly with FAO on identifying the gaps on legislation pertaining to AMR. And we have the design process of how we are going to conduct the intervention, coming out with the standards, resolutions, some agreement with the country, and then the actual intervention, like conducting awareness raising, technical assistance, and the delivery and dissemination of all these activities. Okay, so at the national level, the PBS is our main activity, similar to the GEE in WHO, where we conduct evaluation of critical competencies, and most recently, we have a very specific critical competency examining the gaps on the AMR activities inside the country. Okay, with this link on the PBS evaluation is the PBS, PBS legislation support program, which specifically identify what are the gaps of the legislations pertaining to AMR. And we have done some pilot missions with the collaboration jointly with FAO. Okay, so another activity that we also conduct is to strengthen the capacity of the country in identifying how to improve data gathering, is to conduct at the country level, country workshop on how to identify what is the existing supply chain of antimicrobials from importation down to distribution, and then hopefully can estimate the overall usage in the country, and they can submit this regularly to the OIE on an annual survey. Okay, so these are the different levels of interventions. At the country level, EMU database workshop, and then at the regional level, we have the regional focal point training, and then at the global level, we develop communications that's being distributed globally, and also the EMU database that is being submitted to our headquarters. So these are some of the communication materials that developed by the headquarters, and we also translated this to the country. So recently we have conducted this regional training workshop in Kuala Lumpur, and we have also worked with our tripartite, the tripartite workshop that was held in Bangkok in 2018. Okay, so these are some of the country activities we have conducted on identifying the supply chains of antimicrobial usage inside the country. Okay, so we have some of the recent activities in 2020 in Malaysia and also conducted in Indonesia. So with all these activities, I don't have the slides here, but just to identify that the main source of all these activities is coming from one of the donor, the UK Fleming Fund. That's the main source that we are using. And then with some of these activities supported by the Japan Trust Fund. And for this year, starting this year, we have a new funding coming from Australia One Health Partnership that will also partly support our work with the on AMR activities. So those are the three main resources that we utilize by the OIE in Asia. UK Fleming Fund, Japan Trust Fund, and the Australian One Health Partnership through the Indo-Pacific Center for Health Security. Okay, we also, our Tokyo office in partnership with FAO also conduct this network of strengthening diagnostic laboratories capacity on AMR's surveillance, and this being led by the OIE reference laboratory. We have one in Japan, and we have also a collaborating laboratory in Singapore. Some of the in-country workshop, the tripartite together supported, visited Myanmar and also Cambodia in this annual activity, a high-level activity on the assessment of the National Action Plan. So this one is in last year in Myanmar, where the three organizations with OIE also providing some support with the ministers and vice ministers of the both agency, Health and Ministry of Health and Ministry of Agriculture, who were present in this activity. That's it. Thank you.
Thank you very much. Very appreciated. And may I invite the next speaker, Dr. John MacArthur, the Director of Thailand Ministry of Public Health in USAID Collaboration Centers for Disease Control and Prevention. Please.
Thank the organizers for inviting me to say a few words about the work that we're doing on AMR here in Thailand. I just want to start by saying that this year of 2020 is a important year for our collaboration. In 1980, we first started to work with the Ministry of Public Health in building epidemiologic capacity, and for the last 40 years, we've been working very, very closely with our partners to really to highlight some of the things that they are asking us to support. One of the things that is often said in our discussions with the ministry is, we don't need a lot of money from you. What we want is technical collaboration. We want to learn from your technical experts, and I think that's part of what we've been doing in the line of AMR is putting a little bit of money into the relationship, but more bringing technical experts from Atlanta or utilizing some of the expertise that we have here in Thailand to help support the ministry's vision for AMR. So really, I think CDC is a data-driven organization, and so one of the things we really like to focus on in our partnership is helping the Thais to really develop the data to drive decisions. And we do that really through strengthening national and facility capacity on AMR data to analyze trends, analyze outbreaks there, and provide those data so that policy decisions could be made. We also, over the years, have done a lot of work in strengthening laboratory capacities because we know really the epidemiologists are nothing without a laboratory behind them, and so that linkage between the epidemiologist and the laboratories is very important. And then utilizing those data to improve best practices in the health facilities. So it's one thing just to count the number of AMR cases we have, and another thing to try to improve the way that we're preventing them from occurring. And then we all know here that there's a variety of different actors in the AMR space and how we can coalesce the data that are being collected in a way that the ministry can actually use them to drive policy. So the way we work with the Ministry of Public Health is we have what's called a cooperative agreement, which is essentially the mechanism in which we transfer U.S. government CDC funds to the Thai Ministry of Public Health. And along AMR, we've got four main partners. The NIH within the Department of Medical Sciences, Division of Epidemiology within Department of Disease Control, the Department of Medical Services, and then VIII within DDC. And we have four different sort of pathways of support with that. Within NIH, they're traditionally sort of a laboratory and research-based part of the ministry, so really working with them in strengthening surveillance, mostly from the laboratory component. And then within the Division of Epidemiology, our work there is in collecting the epidemiologic data that come through the hospitals and so forth so that we can understand sort of risk factors associated with AMR. DMS, the Department of Medical Services, really they're the ones who are focusing, along with VIII, those two are focusing on improvement of care within the healthcare facilities with regards to infection prevention and control. So just a map of the kingdom to give you an idea of where we're working with those four partners. Really, it's throughout the country. So on this, each of these little icons that have the resistance sign, I know it's clever, but bear with me. But that's where we have hospitals that we're working with in terms of collecting data. And then, looking backwards as we're celebrating our 40th anniversary, very much we want to be forward-leaning and looking forward and how we can continue to support the ministry in their fight against AMR. And I think one of the things we want to do is, as we look forward, we want to look backwards. And we started 40 years ago in building capacity within the epidemiologists. We're very interested in working with the FETP program to support modules to help the traditional FETP fellows respond to AMR outbreaks within health facilities. But we're also engaged in some discussions with the FETP program to potentially develop tracks within FETP that are specific for hospital-acquired infections. And so those are our FETP fellows who have the expertise, not just one or two courses in it, but actually have the full expertise to go into a health facility and do investigations to learn more about AMR and the sources of AMR within it. Clearly, we want to do what we can to help the ministry detect and reduce hospital-acquired infections, and then finally, as more and more sort of high-threat pathogens come up, we want to work with the ministry to specifically target some of those high-threat new pathogens. So with that said, I'll just stop with a nice graphic. Thank you.
Thank you very much. May I invite the next speaker, Dr. Daniel Schar, the Regional Emerging Infectious Disease Advisor of the USAID Regional Development Mission for Asia. Please.
So good afternoon. Thank you very much to the organizers. In fact, coming from USAID, you know, we have a real debt of gratitude to the Royal Thai government, not only for inviting us here this afternoon, but in fact, as an agency for launching us on this endeavor. It was really 5 years ago here in Bangkok at a Global Health Security Agenda meeting that the Royal Thai government hosted, where we renewed our commitment as an agency globally in the campaign against AMR, and in particular at the human-animal ecosystem health interface. So, quite simply, our goal really is to strengthen systems to prevent and mitigate AMR risk. We recognize, as many have spoken about over the last 2 days, that with demographic changes, increasing population growth, the rising wealth of a middle class, that there are going to be challenges in particular meeting growing demand for safe, secure animal source nutrition. And so as an agency, we're really addressing this by working in a multidisciplinary way at the human-animal ecosystem health interface. And again, to enhance capacities, importantly, as has been discussed over the last 2 days, in both the public and private sectors, to institutionalize lowest impact production and marketing practices that prevent and mitigate AMR risk. So I think some of this has been discussed this morning, yesterday. If we look at food animal use projections, nearly 3/4 of all antimicrobials used globally are used in food animal production. The trend is increasing, over 50% growth from about 131,000 tons in 2013, estimated through 2030 to increase beyond 200,000 tons, over 50% growth. On the bottom here, this was just published late last year. This is basically, you're looking at a series of point prevalence surveys that were collected from low and middle income countries, Salmonella, E. coli, Campylobacter, and essentially what you're seeing is an increasing trend in the percentage of drugs that are exhibiting more than 50% resistance, a depletion overall of the drug portfolio, tripling of that resistance trend in poultry, nearly 2.5 times increase in swine, and a doubling in cattle and dairy and beef cattle over the last 18 years. So clearly a trend that we have to be concerned about and associated with this rising increase in antimicrobial use. So what have we done? You've heard actually from many of our partners over the last couple of days, FAO, WHO, FDA, IHPP. Really all of the work is testament to what you all have done and the accomplishments that you have made. I think you heard Joy talk a little bit about the AMR Communications Toolkit, the World Antimicrobial Awareness Week. We've been very pleased to support those activities. The Atlas tool and the Atlas Assessors Training, another activity that we have strongly supported. I think you've heard about the ESBL E. coli tricycle project, so I won't go into that, but again, another example of surveillance at the human-animal ecosystem health interface. And then I think you heard yesterday Ajahn Rungtip from Chulalongkorn University talk about the first in a series of surveillance guidelines that are being developed under the custodianship of FAO, and the first being launched and publicly available now is foodborne surveillance in healthy animals intended for consumption. I don't have to tell you about the tremendous strides that have been made right here in Thailand. And it's really been so edifying to see over the last 2 days the wealth of data and information that is available. I think Thailand, I know Thailand is setting a very high benchmark with an ambitious national strategy with time-bound, measurable benchmarks and the ability to track and monitor progress against those benchmarks. And I think it really shows on a global stage what is possible when you're working across disciplines with everybody pulling in the same direction truly the remarkable accomplishments that can be realized. And so we're very proud to have supported Thai FDA and IHPP in the development of Thailand's antimicrobial surveillance program and in the joint One Health AMC and AMR reports. This is just the sort of broad pillars outlining where we are in this space. I won't go through this in detail, but we're broadly around characterizing use, helping to understand use practices and quantitative use in various animal species and production contexts, surveillance and diagnostics, harmonizing surveillance standards. You heard Dr. Sang Dun yesterday from the Thailand One Health University Network talk about training the next generation of One Health practitioners and instilling antimicrobial stewardship in the next generation. We're very pleased to support that. And then legal and regulatory processes. And I think this is, part of what is really some of the key issues for us as an agency going forward, looking at how can we take national action plans that are already in place and help support the institutionalization and execution of what is envisioned in those national action plans to ensure that they're fully resourced and implemented. I'm working from both the public and the private sector side. And we recognize that on the private sector side, it's one thing to tell producers and those that are associated with bringing food to the table what should be done, but it's another thing entirely to set the foundation, I think, to encourage best practices, to encourage enhanced vaccination coverage and targeted nutrition, all of these things that are necessary, and to see it from an economic standpoint, because ultimately it's really about the bottom line for them. And I think we need to move from doing this because it's the right thing to do to doing it because for them it will be the cheaper and easier thing to do. Environmental drivers of AMR, and we heard about this. It's very nice to see UNEP here. I think there are a number of, Dr. Visanu talked about this yesterday, a number of issues that remain important research questions around the role of antimicrobial residues in the environment, in pharmaceutical manufacturing, agricultural use, in the aquatic environment, and the role of those residues in driving or serving as selection pressure for antimicrobial resistance, amplification of that, and persistence of that in the environment. And then taking the data that we have, and really it's remarkable the amount of data that has been produced globally over the last couple of years, and bringing that to bear in a policy context. Just the very last slide here, and again, this is something that we're going to be embarking on over the next several years, is a really intentional endeavor with the private sector in harnessing their capacities, their networks, and leveraging their positioning and their expertise to accelerate adoption and institutionalization of market-driven, and what I mean by that is economically self-sustaining, low-risk production practices, both in terrestrial and aquatic animal production. Recognizing that the public sector does not produce animals, they don't provide the inputs, the veterinary pharmaceuticals, the vaccines, and they don't process and transport and market those animals. All of that is done by the private sector, and so we really need to be engaging both public and private sectors as part of the solution to test, validate, and bring to scale those practices that can be most successful in reducing risk. So I think we'll leave it at that. Thank you very much.
Thank you very much, Dr. Schar. And I would like to invite the last speaker from Fleming Fund, Dr. Anthony Hassa, the Southeast Asia Regional Coordinator, Fleming Fund Management Agent. Please.
Hi, good evening, everybody, or good afternoon, everybody. I know I've got the last slot, so I'll try and keep it as brief and clear as I can. Thank you for the organizers and fellow co-hosts for inviting the Fleming Fund to present at this event. For those of you who don't know what the Fleming Fund is, it's a UK government initiative that was founded in 2016 to try and address antimicrobial resistance, primarily focusing on low and middle income countries. At the moment, we're working in about 24 priority countries, but if you include some of the other countries that are benefiting from some of the work, it goes up to about 30 or 40 countries. If I walk onto this side, sorry, it's a little bit easier. The main focus of the Fleming Fund at the moment is on laboratory strengthening and surveillance capacity building. in the countries that we work in. There's a little bit of work at the global level looking at frameworks and trying to get data into policy and into action. But the majority of the work, 85% or so, is in trying to build the foundations of laboratory and surveillance capacity at the country level where we work. The items that we mainly fund are in infrastructure, so strengthening laboratories, providing equipment, reagents, consumables, but also looking at things like IT systems, epidemiology training, working through to how we use that information to address antimicrobial usage. The mechanisms in which that we use for administering the funds is through grants. We've got 4 main types of grants. The bulk of them are called country grants, which is about 80% of the funding or so. The rest of the funding comes through the fellowship scheme, which looks at strengthening individuals in the system, which I think Professor Visanu yesterday presented about the Lao fellowship scheme, where we've got 5 fellows there that are receiving training in Thailand. There are also regional grants and global grants, some of which have been mentioned already by the tripartite organizations. And the goal is to try and understand AMR better globally using a One Health approach. So we're not looking just at human health, at the human health sector. We're also working with ministries of agriculture, in some countries, ministries of environment as well, but that's still work in progress and there's plenty more to be done there. In Southeast Asia, you can find out more information on our website, which is flemingfund.org. You can see that Thailand's not colored in there, but we do some work with Thai institutions. But our main priority countries are the countries surrounding Thailand. So as Dr. Surya presented earlier, Thailand in the Global Health Security Index is 22nd already. And so our focus is more in trying to help the countries around Thailand to improve their ability to address AMR. So that includes Myanmar, Laos, Vietnam, Indonesia, Papua New Guinea, and Timor-Leste. In Thailand, we have some economic fellows sitting over there in the middle, Chris and Aparna, who are based within HITAP in the Ministry of Public Health building in Nonthaburi. So they're funded through the Fleming Fund via the Overseas Development Institute, which is a UK think tank, to provide support on health economic issues. And one of their tasks is to look at antimicrobial resistance as well. So they're based in Thailand, and hopefully over the next couple of years or so, they'll be able to help work with the Thai government and hopefully further across the region as well to better understand the economic implications of antimicrobial resistance. We also have the Fleming Fellowship Scheme, which I'm afraid we did have a photo there of Professor Visanu and his team in Laos, who are working with some of the institutions in VNTN to try and strengthen the professional development of individuals within the wider system. The South Center, who are a civil society organization based in Geneva, have partnered with a few organizations, including the Third World Network in Malaysia, who have hosted some events. This was an event they held last year in Penang, which brought together many countries in Southeast Asia, including Thailand. I think you can see Dr. Nittima in the middle there of the photo, to talk about lessons learned and how we can go about trying to improve our understanding of AMR in the region. And finally, our friends from the Tripartite Alliance, you may recognize this from a few years ago at World Antibiotic Awareness Week, and some familiar faces there on the screen. So we've been working with them at the global level, at the regional level, and also at country level in a couple of countries in this region. But to mainly highlight, I think, the support we've been getting from the Thai officers. So the sub-regional office for OIE, which Dr. Ronello leads over there, and also Katinka and the wider ECTAD team at the FAO regional office, also in Bangkok. So I think this is my last slide. So the main thing I want to highlight is, although we're not supporting Thailand directly, there are many partners who work in Thailand. And what we would hope is that what we can learn from Thailand and how you've handled antimicrobial resistance over the last few years is able to support other countries in the region as well. We have a poster outside with a bit more information on the countries in the region, but we also have a website and some email addresses if you want further information. Thank you very much.
Thank you very much, Dr. Hassa. And ในช่วงเวลานี้นะคะถ้าท่านผู้เข้าร่วมสัมมนาท่านไหนมีคำถามก็เดี๋ยวรอถามแป๊บหนึ่งนะคะระหว่างที่จัดเก้าอี้เพื่อที่จะรอ discussion รอบสุดท้ายอยากจะถามเรื่องของโอกาสแล้วก็แหล่งที่เป็นแหล่งสนับสนุนนะคะก็จะสามารถที่จะหาได้นะคะ we waiting for the preparing the stage for 8 panelists and 9 including myself to the stage to provide the Q&A session. If you are ready, can I invite all of you? Dr. Nopporn, Dr. คุณชาติวุฒินะคะ Dr.Richard Brown, Dr.Katinka de Balogh, Dr. Ronello Abila, Dr. John MacArthur, Dr.Daniel Schar, and Dr. Anthony Hazard back to the stage again for the Q&A session.มีคำถามเลยช่วยพิธีกรด้วยนะคะ So you all ready? มีคำถามไหมคะจากฟลอร์มีไหมคะ Okay. It seems like I have to start again. So may I ask you from each agency, because you will get the same question. What is the focal area of the AMR that your agency focus on in the next 1 or 2 years? And the condition of that is in the situation of this kind of COVID-19 outbreak and slowdown of economics. So what would it be in the next, okay, let us say 1 or 2 or 3 years after this about the AMR? Who would like to start? May I ask the, okay?
Maybe it's a little bit easier for me because, as I said, I mean, for AMR, our priorities are the ones that are jointly decided together with the Royal Thai government, principally the Ministry of Public Health. And for the next, or the rest of this year, it's the list of things that I read out. But I mean, essentially what it amounts to is supporting the implementation of the National Strategic Plan for AMR. That's our blueprint. I mean, with regard to the COVID-19, it's really difficult to know what the impact is going to be, but I think it's really important to not lose focus. You know, if at all possible, we shouldn't let an event like this detract from addressing such a serious problem. So as much as it's possible to continue the current work, we should put all our effort into that. But it may depend on how difficult things get.
Okay. Katinka, you move,
Yeah,
so you will be
okay.
the next one, and the FAO side.
Okay, from FAO's side, so far also we have been very much focusing on the national action plans initially of getting the animal health sector and then also the aquaculture sectors more involved, as well as gradually also possibly the wider agriculture sector. Much emphasis was given also on surveillance because also a lot of the funding has been more on surveillance. But in the future we are looking more on the actual practices because we think that there is where the solutions are. If we are able to have better, improved biosecurity, improved animal husbandry practices, the need for antimicrobials will be less. So possibly there is where the activities are. With regard to COVID-19, what that will mean for us, well, we have seen already that some of our meetings are being postponed. For example, even our regional conference for FAO that was supposed to be last week in Bhutan was postponed towards the end of the year. So we see that there is clearly impact, and we also need to see how the resources, will pan out. If resources will be diverted, hopefully not from AMR for other priorities. But as at the moment it's mostly a public health issue, I think our resources are more still those earmarked for AMR, hopefully will remain for AMR. Thanks.
Well, from the OIE side, which I would also link with strengthening of the vet services in the work of AMR and also in combating any emerging infectious diseases. During the last almost 5 years, we've been working on strengthening antimicrobial usage data gathering. One of the key problems we have encountered is really the lack or the weak legislation and policy support pertaining to mitigation of AMR. So we look forward in the coming 2 to 3 years on how the OIE could support countries in reviewing their gaps in legislation and how we could advocate for strengthening their legislation so it can really support the work on AMR. And this also would be the foundation for establishing what we have been working with them on implementing pharmacovigilance of the veterinary services.
So the next, Daniel,
It seems to be moving in this direction, so I'll take it.
I think that is.
Yeah, sure. Well, for USAID, and I spoke about this in the presentation, we're really looking at a renewed commitment over the next couple of years, engaging explicitly with the private sector as a source for change, particularly on animal production and meeting that growing demand for safe, secure animal source nutrition going forward. I agree with Rick. I think it's very important that we don't lose focus and attention and commitment and high-level policy commitment to AMR as a global challenge and the global pandemic that it has been and will continue to be if we don't really make substantial efforts to rein it in. And I think COVID-19 in a way provides us an opportunity to redouble our efforts at the human-animal ecosystem health interface. We're looking at challenges that, again, underscore just how connected these sectors are. And so when we're talking about health system strengthening, we're talking about that really across disciplines. Yeah.
Thank you.
Hi. I think for me, for the Fleming Fund at least, the focus of the last 2-3 years or so has been in collecting data, collecting information, trying to understand the system and the current situation a little bit better. So we've spent a lot of money on lab equipment, on basic surveillance foundations. And what we hope over the next 2 years or so is once that information starts coming in, that people start to use the information to inform policy, to affect behavior change, to lobby for more support for AMR and its importance globally and how it could affect things. The question about COVID-19 is an interesting one. In my view, although it's different to AMR, it does put a light on the importance of surveillance systems and the need to be able to pick up new threats quickly. And from that perspective, I hope it helps to highlight why we do the laboratory work as a first base, I guess, for our fight in AMR.
ในส่วนของสวสนะคะขอเป็นบทเป็นภาษาไทยนะคะก็ในช่วงที่ผ่านมาเนี่ยเราก็ได้ลงทุนไปกับเรื่องของการควบคุมชื้อดื้อยาในโรงพยาบาลอยู่พอสมควรค่ะในรูปแบบของการใช้ยาสมเหตุผลแล้วก็การควบคุมการกระจายเชื้อค่ะทีนี้ในช่วงเร็วๆนี้ค่ะเราก็จะมีอีกโครงการหนึ่งที่ไปดูเรื่องเกี่ยวกับสิ่งแวดล้อมค่ะซึ่งส่วนตัวก็คิดว่า ส่วนที่ยังขาดอยู่ก็จะเป็นเรื่องของภาคประชาชนที่ว่าจะทำยังไงให้เกิดความตระหนักรู้แล้วก็ความรู้ของประชาชนในวงกว้างนะคะที่จะทำให้เขาได้ใช้ยาได้อย่างถูกต้องควบคู่ไปกับการสร้างกฎหมายหรือว่ากฎเกณฑ์ของสังคมอะค่ะที่ช่วยการขับเคลื่อนตรงนี้ค่ะ
So I would say that that AMR continues to be sort of a high priority for the U.S. government. So for the Centers for Disease Control and Prevention, we are dependent upon Congress for our funds. And I can at least say within our Department of Health, the Secretary, one of his highest priorities continues to be AMR both domestically and around the world. And so I think that we will continue to work in these areas that I highlighted in my presentation on surveillance and laboratory and potentially look at more workforce development. And I agree with some of my other presenters is that the COVID-19 scenario presents an interesting sort of interlap with what we're doing in the regards that surveillance is important, laboratory is important. Also, very much so, infection prevention and control. I mean, we know that in Wuhan, well, all over China, I think that they've had over 1,700 healthcare workers infected. And so that sort of talks about the need for IPC within the healthcare facility. It's hard to say. Our secretary, the day after the WHO declared a public health emergency of international concern, our secretary then declared a public health emergency which released special funds for COVID-19. And so that's good that other funds are being put forth where they're not necessarily looking to take the AMR funds. And what I'm hoping, if I try to look at something positive out of this horrible outbreak, it's that it reminds the U.S. Congress, who again makes funds available for Dan's group with USAID and CDC, that it reminds the U.S. Congress how important public health is, whether it's animal health or human health, and that when they're looking at cuts in the national budget, that perhaps they look elsewhere than in public health because of the need for what we do, both surveillance, laboratory capacity, IPC in these areas. And so that's what I'm hoping comes out of this COVID-19.
Thank you.
ครับในส่วนของสสส.จริงมันมีงานหลายส่วนที่สนับสนุนซึ่งกันและกันนะครับเรามีกพย.อาจารย์นินั่งอยู่ตรงนั้นเป็นทีมวิชาการแล้วเป็นทีมวิชาการที่เข้มแข็งนะครับเพื่อถ่ายทอดความรู้ต่างๆเนี่ยลงสู่ภาคส่วนนะครับอาจารย์กพย.มีโน้ตที่สามารถผลักดันงานที่เป็นรูปธรรมลงพื้นที่นะครับเรามีงานสื่อสารสังคมซึ่งจะเห็นว่าแคมเปญต่างๆเนี่ยสสส.เน้นงานสื่อสารสังคมเพื่อที่จะถอดความรู้ความเข้าใจต่างๆเนี่ยครับจากงานวิชาการเนี่ยลงไปสู่ชุมชนให้เกิดผลให้เกิดวิธีการคิดให้เกิดความเข้าใจในประเด็นต่างๆที่เกี่ยวข้องนะครับเพราะฉะนั้นเนี่ยก็จะเป็นงานหลักๆที่ทำรวมถึงทำงานร่วมกับมูลที่เพื่อผู้บริโภคทำให้ประชาชนเนี่ยเข้าใจหลังจากที่เป็นงานวิชาการที่ออกมาแล้วนะครับในส่วนโควิด-19 เนี่ยจริงๆสสส.เป็น Task Force หนึ่งในคณะทำงานของกระทรวงสาธารณสุขนะครับเพราะฉะนั้นเนี่ยเหมือนกันครับเรามีสื่อชุดความรู้ต่างๆเรามีอินโฟกราฟิกเรามีวิธีการสื่อสารกับประชาชนนะครับเพื่อให้แน่ใจว่าเขาเข้าใจว่าเราจะจัดการเราจะป้องกันตัวเองจากอยู่ในการเสี่ยงจากโคโรนาไวรัสยังไงนะครับ
ค่ะยังรอคอยคำถามมีเวลาให้ผู้ดำเนินรายการอยู่ไหมคะ So no one showed me that thumbs up, but I know the schedule. We quite behind schedule about 10 minutes. I would like each of you to say just something, if you would like to, about the AMR campaign or about this meeting, the second national forum on AMR that in Thailand that we hosted during you on the stage. You have a chance to say to the organizer, the organizing committee.
Okay, we're going the other way now. Okay, I think from me, thank you very much to the organizers for organizing this wonderful event and showcasing what Thailand has done in the past few years. I think in all countries there's a long way to go, and we're still trying to work out what to do. But I think Thailand has set a really good example for the region, and I encourage you to continue and to share your learnings with others in the area.
Yeah, I fully endorse that sentiment. I would go further and say I think there is so much to learn from Thailand's leadership in this space on the global stage. It's really just been a short couple of years since Thailand developed its, from scratch, surveillance for antimicrobial consumption methodology and is already publishing reports that capture antimicrobial consumption and antimicrobial resistance trends across both human and animal health sectors. It is really a tremendous accomplishment, and I think we continue to learn from Thailand's example and look forward to opportunities to continue the robust partnership going forward to share that learning across the region and globally. Thanks.
Let me add also to congratulate Thailand for its really tremendous work on AMR, and during the past, since the launching of the strategy in 2016, this is the first country in our region that has set the target of reducing 20% in the consumption in the human sector, and then 30% in the livestock sector. And we have been promoting this into other countries to really look at Thailand, who have set this target, and also to work the same or similarly on community target. And also we really appreciate the way Thailand has set up the SAC, the monitoring of consumption both in human sector, the consumption of antibiotics in the human sector, and also the antimicrobial use in the livestock sector. This joint system, we would like also to be a good example, a showcase to the region, and we have invited Thailand to present this in the coming OIE regional workshop in April, to show to the other countries how the both sectors are working together to come up with this system. So it's really, again, I would like to congratulate Thailand for that.
May I be very short? Impressive. Thank you.
Thank you very much.
ค่ะก็ในส่วนของแหล่งทุนนะคะก็จริงๆก็เป็นหน้าที่ของเราอะค่ะในการหางบประมาณเพื่อมาสนับสนุนงานวิจัยที่จะให้นักวิจัยนะคะแต่ว่าส่วนที่กังวลเนี่ยก็คืองานวิจัยที่อยากได้งานที่มันสามารถตอบโจทย์ของประเทศได้จริงๆอะค่ะแล้วก็ตรงกับความต้องการของผู้กำหนดนโยบายแล้วก็ปัญหาของประเทศอย่างนั้นมากกว่าค่ะ
So one of the things that fallen victim with COVID-19 was my ability to participate fully in this meeting. That when my team told me about it, I had marked it for both days on my calendar because it's such an important issue for the kingdom and something that I wanted to participate in. And of course, I was only able to come this afternoon because of COVID-19. So that's one of the drawbacks. I want to congratulate the conveners again for not canceling it because of the virus, because we know across the region a number of important meetings are being canceled because of fears of mass gathering of people, and I think right now there's not a reason for that. So thank you for moving forward and having it. I also want to just highlight that over the last few years, Thailand's been playing a major role globally in leading the global health security agenda with 2 action packages, surveillance or workforce development and laboratory systems, but also a contributing country on the AMR package. And I think the only reason Thailand did not take a lead in that action package is just because they realized we already have a lot to do. But I know from my role in CDC and my role within the U.S. Department of Health that our secretary has acknowledged the the successes that Thailand's had, and actually tried to invite high-level delegates to participate in side meetings at UN General Assembly. And so that's really, that really sort of harkens to the strength of what you're doing here in Thailand, and the fact that global public health leaders around the world are recognizing what you're doing, and that it's a benefit not only to the people of Thailand, but also the region and the world. So congratulations.
So for me, I know that Thailand has been a leader and a champion for One Health for a long time. So even before the outbreak of avian influenza H5N1, there were veterinarians, I think, working on rabies in the Ministry of Public Health. But that collaboration was strengthened partly through adversity, through dealing with outbreaks of zoonotic disease. But I think for me, the most impressive thing is what you can see up here, all these logos. So the fact that this meeting was organized as a collaboration amongst co-hosts, and I think it really sets the bar very high for intersectoral and interagency collaboration.
Thank you.
วันนี้เห็นพลังคนทำงานทั้งนักวิชาการทั้งคนที่ทำงานกับชุมชนเห็นพลังงานสื่อสารผมคิดว่าเหล่านี้ครับมันจะช่วยทำให้พวกเราเนี่ยก้าวไปอีกระดับหนึ่งแล้วเห็นภาพความร่วมมือในอนาคตเหมือนที่ได้คุยกันว่าจริงโลโก้มันเยอะมากแล้วถ้าเราเพิ่มโลโก้ได้มากกว่านี้อีกผมคิดว่ามันจะสร้าง Impact กับงาน MR ได้อย่างเป็นรูปธรรมนะครับ
So this is the end of this session, and I thank you every great speaker that share, and then we will fight AMR even very, very difficult situation that we are facing at the moment with the COVID-19 and consequently with the economics, I'm pretty sure. And I would like to welcome all of you. Please help me welcome all of them. Thank you. And thank you at the same time. And then I back to Kun Prapot. Thank you very much.
ครับขอบคุณเป็นอย่างสูงขอเสียงปรบมือขอบคุณวิทยากรและผู้ดำเนินรายการอาจารย์วราศินี สาคำดวงเป็นอย่างสูงครับ